It is beyond any doubt that the Scottish Government handled the COVID-19 pandemic in care homes appallingly. The important question is, why? The SNP had failed to distribute emergency funding from Westminster to any care homes. 3 months into the crisis, and only £5,000 from local authority had gone to 15 care homes, with 1,100 staff. During the virus, Scottish care homes took the biggest hit in deaths. Care homes are privately owned and responsible for care. In May 2020 and June 2020, last year, during the pandemic, most elderly people were in hospital rather than care homes. Nicola Sturgeon and Jean Freeman realised that hospitals might get a pandemic tsunami, and that National Health Scotland might need spare beds. As a result of this, care homes were forced by the Scottish administration to accept new residents from hospital. This was without knowing their COVID-19 status. Official orders were placed on the Scottish National Health website for care homes by Nicola Sturgeon and Jean Freeman to say that no testing was available. But this order was then later removed. Hospital patients were transferred untested into care homes to free up beds for the expected tsunami of COVID-19. Care homes were still not being tested. A quote from Jim on the 29th of June 2020 states, "My father died in a care home, and so many people hold Sturgeon responsible for the vast amount of deaths in these care homes." 6 families lost a loved one in the same home as my father. This home couldn't get PPE. None to be had. Probably still in a container in Glasgow Airport. Yes, they should buy their own. But when people get sent out of hospital into homes without being tested, that is not down to the home. This virus might not have made much difference to your life, but it has made a vast amount to mine, and still is. My own treatment has stopped for the past 3 months, not looking for sympathy, just stating a fact. A whistleblower reported people being sent to care homes clearly ill with COVID-19. Freeman and the SNP blamed care homes for not following the correct protocol. The SNP and Jean Freeman said on the 18th of May 2020 that they would not do any tests on residents in care homes because they did not want to distress the residents having swabs done. The decision to discharge elderly patients from hospital into care homes without testing, compounded by patchy testing, caused a big problem. In May 2020, Nicola Sturgeon accepted that the policy of transferring patients from hospital to care homes without testing had cost lives. Failure by National Health Scotland to test care home residents and staff at the start of COVID-19, as well as shortages of PPE equipment withheld by National Health Scotland under Jean Freeman, left care home residents and staff unprotected and at risk. Nicola Sturgeon failed to have any patients being discharged from hospital into care homes tested. Mandatory screening, introduced in April 2020 by Health Secretary Jean Freeman, was a shocking practice of moving potentially infectious patients into homes. 921 people were discharged from care homes without testing in March 2020, and a further 510 in April 2020. This problem quickly spread the virus through the care homes. Elderly patients were routinely sent back to care homes from hospital without a test, and that contributed to thousands of deaths. Figures show that 47% of all deaths were in care homes. The Army had planned to go into nursing homes to do testing in March 2020. However, both Nicholas Sturgeon and Gene Freeman withdrew this idea. A lack of carers meant staff had to move around various homes, and this therefore helped spread the virus. Staff and residents not showing symptoms of COVID-19 were responsible for spreading it in care homes. This came after reports of care home workers forced to queue in busy supermarkets several times a day for basics like bread and milk. No arrangements had been made for frontline workers to have priority, and so risked further spread of the virus as they could not secure delivery slots that they needed to provide for their residents. A care home reported that 141 residents from 9 of their 15 homes tested positive. Sadly, 48 died in 8 of their homes. 4 years ago, an audit identified a lack of PPE, but this was never acted upon by the Scottish National Party. In May 2020 last year, a plane load of PPE from China sat on Prestwick Airport for 2 weeks. And again in June 2020, a further plane load of PPE from China sat on the tarmac at Prestwick for 3 weeks. In May of 2020, National Health Scotland was given priority of PPE supplies in hospitals over care homes. So mismanagement and a lack of PPE resulted in 2,438 elderly people dying. While England built additional hospitals to protect the National Health Service, in Scotland, under the guidance of Gene Freeman, the Scottish National Health Service moved elderly people from hospital to care homes. This was a directive, not a choice for the care homes. The pandemic moved through the care homes like a tsunami and resulted in 2,438 dead. By the 10th of May 2020, out of a total of 3,213 deaths in Scotland, 2,438 were in care homes. In England, new hospitals called Nightingales were built, ensuring enough beds available for COVID-19 virus people. The Labour and Conservative members of the Scottish Parliament both insisted on a full public inquiry about how this national tragedy turned into a national scandal. Petitions and requests went unheeded. In May of 2020, elderly patients in hospital in Scotland had a "do not attempt to resuscitate" form slipped into their discharge notes. This left them living in fear and anxiety. A care home on Skye was fast to declare a death, this being the domain of Ian Blackford. Blame for the care home death quickly moved from the devolved administration to the care home owners. In June of 2020, the Scottish National Party made care homes staff a coronavirus supplement of £230. A pathetic amount in relation to their own parliamentary pay increases.